Hello, I'm Susan Acott. I'm the Chief Executive at East Kent Hospitals Trust, and today I'm here with colleagues from the Blood Transfusion Service. So firstly, Catherine, if you can introduce yourself, and I should say that Catherine's at home, so she's talking to us over WebEx.
Yes, through the virtue of technology, I'm with you. Hello everybody, my name is Catherine Lorenzen. I'm the Chief Biomedical Scientist in Blood Transfusion across the Queen Elizabeth and the Kent and Canterbury sites.
And I'm Angela Green. I'm the Blood Transfusion Coordinator and Quality Lead for Haematology and Transfusion across the 3 sites.
Great, so the pathology department is the beating heart of the hospital with all roads that lead there. But at the moment, we couldn't really talk about what you do without talking about COVID and the effect it's had on you and what you've been up to. And we've heard quite a lot about the research that the hospital has been involved with. So can you just tell us a little bit about how that's made a difference for your staff and what you've really been focused on in the last few months?
Yeah, so it's meant that we have worked very closely with the research team, and we have got involved in both the convalescent recovery plasma trial and also the REMAP-CAP treatment trial, which are 2 trials running at the moment. The convalescent plasma is coming out of the University of Oxford. And basically, this is when we are using convalescent plasma, which is plasma that's donated from patients who have successfully recovered from Covid-19. And this means that their plasma will contain the antibodies that may help treat Covid-19 patients who are currently infected. So this is a completely new product and it's being used for clinical trials only. So we've not had to handle it before. We've not been involved in a trial like this before. So it's a very new and exciting, I guess, out of a very tragic time for somebody who's working in pathology at the moment.
Now, Angela, I don't think I've heard so much talked about research in this organisation since I've been here. Have you ever known at a time like this?
No, and this is the first that transfusion have been very involved actually in a trial. So I think we're all quite excited.
It shines a very positive light on research and the options for your staff. How do you think some of your staff feel about the chance to be involved? I mean, as Catherine said, it's quite a tragic situation at one level, but in terms of your scientific community, I guess it's intellectually very stimulating.
It is, and they were actually incredibly excited to be offered the opportunity that they could be part of this. So when we first started hearing about the trial, the staff were coming to me saying, is this something we can do? Can we have this product? Are we able to offer this to patients? And certainly when they would see patients' names come through day after day, they would be saying, do you think we could start getting involved? So they were all actively reading about this, looking it up on the internet, and all 3 sites very, very excited.
I suppose for once, the research suddenly feels very immediate in its impact on the patients as opposed to waiting years and years and years. And Catherine, you were saying that in some respects, the way blood is used and the blood transfusion service is being turned on its head with this.
Yeah, so absolutely. I mean, we are trained in blood transfusion to actually transfuse very conservatively. So, we're always reviewing the products that are being given to the patients to make sure that it's appropriate and to make sure that we have 100% traceability. We could always do a recall if we needed to. So this has really turned it on its head because we are now transfusing a patient with a blood product. And if you followed our dosing criteria for that patient, they wouldn't actually be eligible for a blood transfusion product. What they want is the antibodies in the product. So that's the first thing. And the second thing is the patients who have actually come forward to become donors and actually donate this product under normal circumstances would not be considered eligible to donate because they are recently recovered from an extremely serious disease. So anybody who's ever donated blood before knows that the donor's health is absolutely paramount. And so we would not normally take a blood donation off somebody who's been pregnant recently, who's had a major operation recently, or who has just recovered from a serious illness. And these patients who are coming forward to donate the recovery plasma fit that last group. So it's turned our thought processes on its head by A, giving a product to somebody who we would not normally transfuse, and B, having a donated product of somebody who would possibly not be suitable as a donor in a previous instance.
Very, very interesting, actually, very, very interesting. Do you think your staff recognise just how front and centre they are in this unique situation? I mean, particularly some of your younger staff, perhaps. How are they feeling about it?
I think the staff have been really good. They've adapted to everything. When this first came along, we obviously have very strict ways of working, and then all of a sudden we've written a new operating procedure that they're going to be following. We've got training they've all had to do, and they have all stepped up to the plate and done it. They all know exactly how the process will work, and they've all been really keen to be part of it.
I think people have really wanted to feel that they're making a contribution to this and that they're part of the fight. Just in terms of how the lab has changed, obviously we're doing less of certain things like elective procedures, but loads more of other things. How are other things changed in the laboratory?
So lots of the usual work that we would have received obviously decreased because of the elective work, etc. And then the GPs were not sending in so many bloods, so that all changed. But then at the same time, we're having to learn new assays. In the beginning, in January...
What's an assay?
The assay is the way we test something, so the test. So in January, we had never performed a COVID test, but now we've performed thousands and thousands. So the laboratory staff have to learn how to use the platform differently, how to interpret the result, how to report it for the clinician, and then staff from different laboratories then stepped in to also support. So we've all been supporting each other in different ways and suddenly doing things the same as everybody else that they weren't doing before. And then once we've got through the testing of the COVID swabs, then we've started looking at the antibodies. So again, we've recently started doing all the antibody testing. And then for the phlebotomy as well, they've obviously worked differently because the phlebotomists have suddenly been bleeding all of our staff for the COVID antibody test as well. So everybody's suddenly doing something different in a different place to how they were a few months ago.
Just at the end of this, when you reflect on what's happened in the last few months, what would you want to keep? What do you want to retain? And what do you want to remember out of this period?
I think it's absolutely wonderful that we have been able to provide this service, to be involved in a research trial. For me, I've been doing this job for 35 years and something like this doesn't come along very frequently. So to be involved in the wider hospital, to be working closely with the research teams, to really feel part of a team who's actually making a difference to our patients is absolutely fantastic. And also I think for me to see that internationally, not just nationally, we're not just talking about the National Blood Transfusion Service in the UK, that internationally blood transfusion teams across the world are uniting, sharing information, and it's just moving towards one common goal. I'm so proud and delighted of that we've actually had the chance to be part of that, and I'm so proud and grateful of this to the staff who have just embraced this and got involved, and we really feel that we are making a difference. We really feel that pathology as well has become elevated. I think there's not a person in the country now who doesn't know the difference between a swab and an antibody test. So for us, it's been wonderful to have our services elevated, that people now have a bit better understanding of what we actually do.
Yeah, so and what about you, Angela?
Just so proud on how everybody adapted so quickly. Everything moved so quickly, and then to support, so for example, to support our ITUs, we suddenly thought we would need to offer different tests on all three sites that were only on one previously. So again, just so proud of the way the staff learnt the new ways of working, learnt how to perform the tests, learnt how to report them, so that we could get a better turnaround time for the patient to get the answers back quicker and make that difference. And certainly with some of the coagulation assays that we were then performing on different sites that we didn't used to do, to support those patients with their anticoagulants due to the clots and things that form with COVID.
It's amazing. You must be very, very proud of your staff. And just in terms of, for people who are listening, particularly if they have had COVID or are quite interested in what you're doing, how could they find out a bit more information?
On how to donate plasma, go to the NHSBT, which is the National Health Service Blood and Transplant website, and they will be signposted, and then you just need to register your interest and someone will come back to you and will let you know the next steps and how to donate.
Well, I think you must be very pleased and proud of your staff, and as you said, Catherine, that sort of sense of a global effort, but also pathology perhaps being a bigger part of the hospital, or a more obvious part of the hospital, rather than just the engine room that nobody actually sees, is remarkable, and I hope we can all retain that going forward. So thank you very much for your time. Thank you very much to your staff and everything that you've done, and I'm really thrilled to hear you say that you really think that you and your staff have made a difference. It's fantastic.
Thank you. It's been a pleasure.